Hello, this is Nurse 3006 Assignment 3 from Group 1. We will discuss the Scenario 1, how to critically appraise research and analyze your own nursing practice. Following the question A to D, we will do role play for one bad case and one good case and discuss them as a team. Thank you for watching this video.
Hello Minu, my name is Chan Jin and I will take care of you today. I've got a handover that you got a hip replacement surgery and a difficulty in mobilizing. How are you feeling today?
Actually, I worry about my back. I do not want any pressure injury.
Right. Since you have a high risk of pressure injury, I will set your bed with air mattress. I also will turn you every 2 hourly.
Oh, that would be nice. But does that mean that you will turn me during the night as well?
Yes, I'm so sorry about that, but I need to do it to prevent your injury.
7 hours later.
Oh, I got so stressed. And I cannot go sleep because of the interruption. Can you please stop waking me up during the night?
Hello Minu, how are you today?
Actually, I'm worried about my back. I do not want to make any pressure injury.
I see. I will use the best possible up-to-date evidence-based practice to care you. There are many studies regarding pressure injuries, and according to 5 studies in evidence level 1 and level 2, 2-hourly repositioning with the air mattress was not effective compared to 6-hourly repositioning with the air mattress. Oh, and the research says that 2-hourly repositioning can increase the patient's stress and deteriorate the health outcome. Okay, let's make a care plan with a team discussion and increase the frequency as a 6-hourly repositioning.
7 hours later.
I had a good sleep without any pressure injury. Oh, this is good. Thank you, G. You are the best.
Okay, so we compared 2 different scenarios. Both nurses recognized the risk of pressure injury and provided interventions, but the difference was applying evidence into the practice. Can you explain more about evidence-based practice, Jihee?
Sure.
The evidence-based practice is delivering healthcare that integrates the best evidence from studies. It is one of the essential responsibilities for RNs to use up-to-date evidence into the practice. The evidence-based practice consists of 5 steps, including asking clinical questions, assessing the best evidence, appraising the data, applying the evidence, and assessing the effectiveness.
Yes, and you need to care about the level of evidence as well. Levels of evidence are assigned to studies based on methodological quality of their design, validity and applicability to patient care. Look at this picture. The level 6 and 7 includes expert opinion, case report, and personal observation. Although they are validated, this evidence does not have numerous cases. The level 5 is reviewing these level 6 and level 7 studies for more reliability.
Right, and the level 4 includes single non-experimental studies, such as uncontrolled cohort studies. In this study, all the participants are given a treatment and simply followed for a period of time to see if they improve, with no comparison against another group. In contrast, the level 3 includes controlled trial study, which have comparison against another group. However, it does not have randomization, the process selecting the patients randomly.
Yes, that's the difference from the level 2. The level 2 has randomized controlled trial, which is called RCT. In this trial, the participants are randomly assigned to the experimental or comparison group. By performing certain intervention to one group, the researchers compare the result of the 2 groups to define the effectiveness of the intervention. The level 1 is systematic review or meta-analysis of RCTs. This is reviewing various results of RCTs which have the same or similar goals.
Oh, I see. As a new graduate nurse, we need to follow evidence to provide safe and effective health care to our patients.
Hey G, how are you today?
I'm fine. Actually, one of my patients have the high level of anxiety and she doesn't have any medication. So I need to find out some non-pharmacological treatment for her. I need to find out some evidence as the evidence-based practice.
Okay, let's go and have a look.
What? There are 776,000 results. Oh, how can I find the most useful one?
Hey G, how is it going?
Oh, I'm still reading a bunch of research. There are so many research data. I think I ruined my whole day with my poor time management skill.
Hi Minu, how are you today?
Hi Chanjin, I'm good. But one of my patients has high anxiety level, but she just refused to take administration. I think I need to find some research for evidence-based practice.
Yep, sure. Let's go have a look.
Yeah.
Oh, I got lots of research data here. And I want to most accurate and relevant data. For the most relevant, I'll filter the data. My patient is elderly woman in post-operative condition and she was some non-pharmacological intervention.
Hey Minu, how is it going?
Oh yeah, it is going well.
Oh.
Have a look here. I just filtered the research results and find the most relevant data. I think now I'm going to check if the research was conducted through the right method and using critical appraisal tools.
Wow, you are doing the research very well.
Yes.
You manage your time efficiently and provide the best patient care.
Yeah.
That's amazing.
So we compare two different stories. The newly graduate nurse tried to use the research evidence, but he had a difficulty in finding the most applicable one. That's why we need the process of the critical appraisal. Can you explain what is the critical appraisal, Chanjin?
Sure. Clinical appraisal is reviewing research thoroughly and methodically to determine reliability, value of research. In critical appraisal, clinicians assess the worth of research studies to clinical practice. Nurses must be confident their care techniques to achieve the best health outcomes.
Yes, you're right. It is assessing if the research and the result can be applied into the patient care or not. It requires various criteria to be applied to review the practice.
That's correct. Then what kind of criteria could be applied for critical appraisal?
It depends on the types of the research. The basic criteria that can be applied for all research include the result validity and relevance. The former, research validity, is assessing if the findings of this study provide unbiased estimate of the treatment effect. It also includes checking how precise are the results. The latter, relevance, indicates whether the results of a study are meaningful or not.
I see. I heard there are useful tools for critical appraisal. Can you explain what they are, Chanjin?
Sure. Look at this picture.
Firstly, CASP2 can be used for qualitative research. It consists of 10 questions to check its validity and relevance. It is an effective tool for appraising the strengths and limitations of the research. Secondly, the PEDRO scale can be applied to the randomization controlled trial or controlled clinical trial. The PEDRO scale scores 10 items including random allocation, similarity and baseline, subject blinding, and therapist blinding to measure the quality of clinical trials.
Assessing through the checklist, we can select and apply the best evidence to our practice. They would allow us to reduce information overload and identify the most relevant papers.
Hi Chanjin, how's it going?
Not that good. I'm taking care of 4 patients today, and one of my patients developed a pressure injury today. I didn't give the right treatment at the right time. I feel so bad for my patient.
I see. Preventing and managing pressure injury is very important. That's why I print out this poster. Did you see that?
What? This poster was talking about pressure injury? It was so difficult to read.
That's true. But were you really interested in the posters in our ward? We have several posters on our notification board.
No, I didn't know. I didn't have time to read all those posters on the ward. I feel so bad.
Hi Minu, how is it going?
Hey, I'm good, thanks. For today, I'm looking after 4 patients, and they were just admitted to our ward with following the fracture.
Oh, they must be very painful. I saw you were looking at something. What is it?
This is the clinical poster talking about preventing swelling. Many of patients in our ward have a severe swelling, which may develop compartment syndrome. So it is very important job for me to prevent, monitor, and manage swelling symptoms. This poster helps me to do that properly.
Wow, you are providing evidence-based practice following this poster. And this poster looks very easy to read as well. Wow, so amazing! So we compare 2 scenarios about the knowledge translation. Chanjin, can you explain what is the knowledge translation shortly?
Sure. The knowledge translation is a process in which a research knowledge is applied into the clinical practice in an appropriate manner. Translating research evidence to clinical practice is essential to safe, transparent, and effective healthcare practice and meeting the expectations of the patients, families, and society.
You're right, Chanjin. However, the important thing is that it is not just one-sided communication. It requires an active interaction between researchers and knowledge users, including health professionals and patient and health public. It requires the process, synthesis, exchange, application, and dissemination.
Right, look at this picture. The first stage is synthesis, integrating an individual research studies within the context of the global evidence. It is considering the potential impacts of implementation of the knowledge. The second stage is exchange. It is a knowledge translation between researchers and users, including healthcare professionals, patients, and public. The third stage is application. This is a process of applying the research into the practice as an evidence-based practice. The last stage is dissemination. It is the process of communication, receiving feedback. It contributes to improving the quality of the evidence.
Okay, following the 4 steps, the knowledge can be translated to the nursing care and helps to improve the patient outcome. During the last clinical placement, I saw some visual presentation papers hung on the wall in the ward. Is this a form of knowledge translation?
Yes, that's correct, Minu. Look at this slide. There are 3 the most frequently used methods for knowledge translation in the clinical settings: educational seminar, visual cues, and educational materials. The educational seminar is informing and teaching the health professionals about specific clinical knowledge. According to a recent research, the educational intervention resulted in the largest effects on nurses' use of research evidence.
I see. I think the visual presentation paper in the ward should be one of the forms of the visual cues. Is that right?
Yes, you're right. Visual cues also include the signs in the clinical area, which allows the nurses to read evidence in the clinical settings frequently. It promotes the use of knowledge to the patient care. Also, the educational materials include evidence-informed guideline, protocol, or pathway, which can promote a practice change in nursing. Considering that all nurses need to follow the organizational guideline, the knowledge in the guideline should apply the high level and quality of the evidence.
Hello, Chanjin.
Oh, hi.
My name is Minu. I will be your nurse today. How are you feeling?
Actually, not so good. Can you please get rid of this oxygen mask? Please, it's so uncomfortable.
Chanjin has COPD, but he feels uncomfortable. But the oxygen saturation is 95% now. Probably you'll be fine. Alright, Chanjin, I will just disconnect this mask.
Thank
Is that
you.
right?
Thank
All
you.
right, no problem.
A few moments later.
I can't breathe. Oh, nurse! Nurse!
Oh, why is it not connected?
Oh, sorry, G. It was my mistake.
Didn't you make the same mistake last week? Without the self-analysis with the evidence, you will make the same mistake again and again.
Yeah, I'm sorry, my bad.
Hello, Chanjin. I'm Ji-hee. I will be your nurse today. How are you feeling today?
Oh, hi, Jihi. Actually, I'm not doing so good today. Can you please take off this oxygen mask, please? It's so uncomfortable.
I experienced the same situation last week, and I self-analyzed my behavior. I searched many research evidence and all says the patients with COPD need to get oxygen despite the concerns about the side effect. I'm sorry, Chanjin, but you have the COPD. All the research data says the patients with COPD need to get the oxygen mask. But if you are really uncomfortable with the mask, I can change the route as the nasal tube. Is that okay?
Oh, yes, that would be so nice. Can you please do it now? Thank you.
Okay, everyone. So we watched two different scenarios. How do you think about them? What is self-analysis in nursing practice?
I found the self-analysis in nursing practice is very important. As the last part of the clinical reasoning cycle, it reflects our practice from the beginning to the end. It includes making care plan, patient care, and discussion with team members.
Yes, you're right. As a nurse, we need to correctly evaluate that what we've done in our nursing field. Then, how can we analyze ourselves? What kind of ways are there for analysis?
We can apply the reflective process to our practice. By reflecting our previous actions in patient care, we can bridge the gaps between evidence and practice and acquire new insights by investigating various perspectives. Generally, Jordan-Gibbs models are the most frequently used for nursing reflective process.
Yes, specific process of each model is different, but both focus is three important things. Firstly, it involves reviewing the description of certain situation, including various factors such as patient data, involved people, provided interventions, and final outcomes. It allows to comprehensively understand the situation, which is basis for reflection and self-analysis.
Correct. The next stage is exploring evidence as a critical analysis. It focuses on the influences of the evidence and interventions that affect the patient's health outcome. It is investigating how the nursing knowledge, the evidence was applied to the intervention.
Yes, and the last stage is developing insights focusing on the improvable factors for future practice. It requires searching updated evidence that can be applied for improved future practice. By analyzing our previous actions and considering improvement of the practice, we can develop our nursing competency as a newly graduated nurse.
It sounds like being an expert nurse from newly graduate nurse. That's great.